Two patients walk into the same hospital. They receive the same treatment. The same doctor performs the procedure. The same nurses assist in the room. From a medical standpoint, their care is identical. But when the bills arrive, something shocking happens. One patient pays $300, the other receives a bill for $30,000. Same hospital, same treatment, same doctor. So how does that happen? To understand why, you have to look at a system most patients never see. Because behind every hospital bill is an entire financial structure made up of contracts, codes, negotiations, and rules that most people never encounter until the day a bill arrives. And once you start looking at that system, the numbers on a medical bill start to make a lot more sense. Most people assume medical prices work like prices in other parts of the economy. If you order a meal at a restaurant, the menu shows the price. If you buy a phone, the price is listed on the shelf. Healthcare doesn't work that way. The number printed on a medical bill is often not the price anyone actually pays. Instead, it is often the starting point for a complicated negotiation process that takes place behind the scenes. At the center of this system is something called the hospital chargemaster. The chargemaster is essentially a massive internal price list. Every service the hospital provides appears on this list. Blood tests, X-rays, CT scans, surgical procedures. Each one has a listed price. And in many cases, those prices are extremely high. A procedure that ultimately costs a patient a few $100s might appear on the chargemaster with a price of tens of thousands. But these prices are not necessarily designed to reflect the real cost of care. Instead, they serve as a starting point for negotiations with insurance companies. Insurance companies rarely pay the full chargemaster price. Instead, they negotiate contracts with hospitals that determine what they will actually pay for specific services. These agreements are negotiated months or even years in advance. And once a contract is in place, the insurer agrees to pay a predetermined amount for certain procedures. So while the hospital may list a procedure at $30,000, the insurance company might have negotiated a payment of only $300. The rest of the charge is removed through something called a contractual adjustment. In other words, the hospital writes off the difference because the contract requires it. This is why patients with insurance often see a large number on the initial bill, followed by a much smaller number labeled insurance adjustment. After that adjustment, the patient's responsibility may only be a small portion of the original charge. But here's the part that surprises many people. Even when insurance negotiates the price down to a few $100s, the original $30,000 charge still exists in the system. And in some situations, patients actually receive that full bill. This can happen when someone does not have insurance. Without an insurance contract in place, there may be no negotiated price to reduce the hospital's listed charges. Instead, the patient may initially receive a bill that reflects the full chargemaster price. This is one reason medical bills can look so high at first. Hospitals often have programs to reduce costs for uninsured patients or to provide financial assistance. But the first bill that arrives can still be shocking. And that shock is often what brings attention to how complicated the healthcare payment system really is. But pricing and insurance contracts are only part of the story. Another key part of the process involves medical coding. Every treatment that happens in a hospital must be translated into standardized billing codes. These codes describe what happened during the visit. For example, procedures are represented by CPT codes, while diagnoses are represented by ICD codes. Medical coders review the physician's documentation and assign the appropriate codes for the services that were provided. Those codes are then sent to insurance companies as part of the claim. Insurance companies use the codes to determine how much they will pay. If the coding is accurate and the service is covered under the insurance plan, the claim moves forward through the system. But even small differences in coding can affect how a claim is processed. A missing modifier, a different diagnosis code, or a documentation issue can change how the insurance company interprets the claim. Sometimes the claim is delayed, sometimes it is reduced, and sometimes it is denied entirely. When that happens, the bill may shift from the insurance company back to the patient until the issue is resolved. The result is a system where multiple factors interact with each other: hospital pricing, insurance contracts, medical coding, claim processing rules, and each of these elements can influence the final amount that appears on a medical bill. This is why two patients receiving the exact same care may ultimately pay very different amounts. One patient may benefit from a negotiated insurance rate. Another may have a higher deductible. Another may be out of network. Another may have no insurance at all. From the outside, the numbers can seem confusing, but inside the system, each step follows a set of rules that determine how the bill moves through the process. The healthcare payment system is one of the most complicated financial systems in the world. Hospitals, physicians, insurance companies, billing departments, and government regulations all interact in ways that most patients never see. Each insurance plan may have different rules. Each hospital may have different pricing structures, and each claim moves through a system designed to translate medical care into financial transactions. That complexity is part of the reason medical bills can look surprising. The numbers on the page are often the result of layers of negotiations and rules that took place long before the patient ever walked into the hospital. So when someone receives a medical bill that appears impossibly high, it doesn't always mean the hospital actually expects to collect that full amount. Often it reflects how the billing system records charges before insurance adjustments are applied. Once insurance contracts, coding rules, and payment agreements enter the picture, the final amount can look very different from the original number. A $30,000 medical bill doesn't always mean someone received $30,000 worth of care. More often, it reflects a complicated system of hospital pricing, insurance negotiations, and billing rules that most patients never see. And once you understand how that system works, the numbers on a medical bill start to tell a very different story. Because behind every medical bill is a system of contracts, codes, and negotiations. And sometimes, that system produces numbers that seem almost impossible.